There's some over 100,000 vacancies, and there's a very high turnover of staff. Do you think we can address the shortage of carers if the government sticks with its current policy around care workers not qualifying for health visas post-Brexit?
So I think this is an enormous challenge. One of the things about the social care sector is it's often invisible. We don't realise we've got roughly the same number of people working in social care as we have in the NHS. Huge numbers of wonderful and dedicated people. Many of them very long-standing residents of the UK, but many of them newer residents of the UK and doing a fabulous job. I think there is potentially an enormous challenge. We're going to need more people. If we have more funding, I hope we'll have more people drawn in. I couldn't claim to be expert on how that's worked in the last 2 or 3 years, but I would certainly be anxious that we could end up with constraints in this area, and that's something we'll have to look at very carefully over the next few years.
Thank you. I mean, it's not just, I think, the recent announcement around health visas that's been an issue when it comes to care work. You've got low pay, poorer terms and conditions than that of NHS staff or other healthcare staff, delays in protections of care workers during the pandemic. I mean, Lord Forsyth said it was, and quite rightly so, it's a question of priorities. How do we get policymakers and government to raise the status of care work and also see this as a priority when there are so many other competing priorities as well?
I wholeheartedly agree. And something that I've often said when talking about this is we hear a great deal about the burden of aging, and actually we should be celebrating this extraordinary triumph that people are living longer lives. And we should also be very clear that quality of life isn't necessarily low when you need social care. Actually, people can make great contributions while needing social care and can have quite high quality of life, not in all circumstances, but in many, while receiving social care. So we should be celebrating this. We should be looking at it and talking about it more. And I think that there's just no doubt we need a change in society's attitudes towards old age, towards the experience of disability, and towards those who are caring for those who are old and need support because of their disabilities. So it's not something that just government can do. I think we all have to be a part of celebrating aging and celebrating caring. At the moment, there's a tendency to look away from this, and this has been true, I think, of successive governments of all political persuasions. I think that's partly been because we haven't had a system of which we could be proud. I hope that if we make some reforms here that make the system better, rather than thinking of this as something we don't want to pay attention to, we can all start paying attention to it and celebrating not just the people who are being looked after, but also the great work of the people who are doing the looked after. And maybe one of the silver linings of the cloud of the last 4 months could be a greater awareness of and acceptance of the fantastic job that is done, of course, by the NHS, but also by this other bit of our caring structures.